Welcome to our podcast, proudly brought to you by VPA Australia, our trusted supplement provider since Unity Gym started. As sponsored athletes, we're excited to offer you a special 10% discount on top quality supplements that ship worldwide. Just use our discount code from the description. To avoid international shipping fees, contact VPA and tell them we sent you to get a flat shipping rate. Today's episode is also sponsored by the Flexibility Blueprint. Ever felt lost in the sea of social media fitness advice? The Flexibility Blueprint is your map to progress, designed to help you get laser focused on what matters most for your journey in flexibility and strength. And guess what? It's free. Grab it using the link in the description. If you're starting your flexibility journey, don't miss our 20-minute mobility routine. It's your first step to quick wins in flexibility. For those further along, use our Flexibility Masterclass, featuring advanced techniques like loaded stretching and end range strength for the pancake, front splits, middle splits, and more. Links for both are also in the description. And for the seasoned athletes, avoid the frustration of complex training puzzles with our UMS Tribe membership. It's a different online coaching experience with strength and flexibility combined. Don't forget, we're Amazon affiliates too. You can find all the equipment used in our videos and podcasts at the most competitive prices with our affiliate links in the description. Now, let's dive into today's episode.
All right, how are we, Tribe? We're here with the pain management professor, Phil White again. I love...
Are you writing these down before you start? Because I'm shocked and appalled at how quick you are.
They just come to me in the moment and I go with it. Phil is an old-time friend of ours, and anyone who knows us well will know Dr. Phil. He's been on our podcast many times. He really dislikes me using the term Dr. Phil, but
well, I am a doctor of physiotherapy, but technically,
I think he's gotten used to it. I think he embraces the Dr. Phil status, and I'm going to throw my hat in the ring today as well. I won't say much today because I am still a little bit man-flued up, but I'm here. I'm not in the shadows today.
Rocking the man flu. Rad is rocking the man. He's always behind the scenes, but he has been rocking the man flu, and I've kept him off the mic because it sounded like he was trying to speak underwater with all sorts in his nose. Anyway, how are you today, Phil?
Yeah, really well. We got a bit of flu going around our household as well, but I've somehow dodged it with my, incredible immunity somehow. So feeling good, and just loving being back on the show and talking about this stuff. And particularly, I've been writing a lot recently about all things health and fitness, very much inspired by what we used to do back in the day, some of the key topics we used to talk about. And then it's really nice coming back to podcasts, having written a bit, because it all just starts to really flow nicely in your brain and give so many good ideas and see what works. It's good.
Absolutely. Yeah. Look, the way that we work here, Rad and I'll film a podcast, and then I will transcribe the podcast, and then I'll turn that into one, two, or multiple articles. And then I'll go back through and read those articles, and I will dig into elaborate on key points and turn those key points into an article. And then I'll read that and go, oh, that'll make a really good podcast episode. And so it creates this cyclical loop of amazing content creation.
Read any of my work, I'm mostly doing Twitter, and I guess for you, it's the email list, hey?
Yeah, that's right.
Yeah.
That's
so
right.
For those listening,
our guys are starting to reuse the blog articles that go on the website and in our newsletter to create content off the back of that again. So it gets sort of rehashed, and we use them to create new scripts for new videos. So
there you go. You can listen and read our work constantly, all day, every day. Like you.
That's right. Never escape. It's like a bubble of unity and Phil White. That's, if anyone's wondering, looking on the video, that's me in the bubble of unity and Phil White. If you're listening on the podcast, we also pop these up on YouTube. So, we've had a couple of great discussions lately, and we're getting absolutely flooded with questions from people who are injured, overcoming whatever injury. The most common for us is lower back pain and shoulder pain. We seem to have a lot of slap tears in our community. People who have
essentially people who aren't getting injured doing your work. It's they're finding you as the answer. So.
No, that's right.
That's right. But that's not a surprise. That's because of the slap tear video that I've got on YouTube. That's up to like 15,000 views now. So people are obviously watching that and going, "Wow."
That's why I was wondering how people were finding us for slap tears. Anyway, there's a couple of things that I want to talk about today, and the most important is that, and we sort of touched on this in an earlier podcast. I want to get your opinions on the variables that we can manipulate to manage load. And this is part of the bigger picture load management story that most people tend to get wrong in the gym. And it can be broken into so many different subcategories and really taken in many different directions and discussions. But most importantly, for the purposes of this conversation and making it relevant for our tribe who are working out in the gym, what are the variables that we can manipulate to manage load? And by managing load, I mean, actually, you know what, Phil, because we stole this from you, why don't you give us your load management analogy, the bucket, the cup, the swimming pool, and just explain load management first. Let's start there.
Yeah, cool. It's been a while between that analogy. So I might just talk about how I'm currently thinking of it, because yeah, it's something that just comes up over and over again. Because unless you've got an injury where you have kind of one acute mechanism like a rolled ankle or something like that, or a torn ACL, or it's typically these like overused chronic injuries come about from a loading error that comes from maybe not approaching training in the most optimal ways. Now, acute injuries can definitely happen when you're overloaded, not recovering well, fatigued, but most commonly, yeah, it's these kind of chronic tendinopathies, cartilage damage, and all these things that can be really down to the load management. So if you think about load management in two different factors, so I used to call it the macro and micro load as the two big categories, but now I've actually changed that to the what and the how, just to simplify things. So the what would be basically your program, what you're doing, uh, how much you're doing. So what you're doing each day, what you're doing as part of your whole program, how much rest you're getting in between sets, in between reps, how you're, the tempo of the exercise selection, all of all of the what's basically, and that's coming down to the big picture, how much load you're getting in total as a week, and then over time, and if you're increasing that too quickly, or um, maybe being really gradual, you'll have a different response to the load. So then the how, which I used to call micro load, is basically in the moment of the exercise, how you're doing the exercise will have an influence on the loading of the exercise. So, not all squats are equal. If you dive bomber squat with, as in doing no eccentric loading, if you just drop to the bottom with a bunch of weight in your back and you don't have very good technique and come back up, that's going to be quite a different response to the body than a slow eccentric with a pause at the bottom and bracing throughout. So that's the exercise technique of the how, and that's the relevant in gym exercise, but then also running technique or sports throwing technique, all of the how of the completion of the exercise is going to have a influence on what you're doing, so on the complete load of the system. So, and the reason why that matters is like stress to the body, or strain, if we call it like strain to the body from training, is what makes us stronger. But the body only adapts if you give it adequate time and adequate recovery. And so if we're looking at how to get that right, then we think about the total load on the system, and then if something goes wrong, we look, okay, where has it gone? Where have we done too much too soon, or not given adequate recovery, or just overloaded compared to what the body is used to?
Yeah, you could say, I guess, in some ways that there is both a positive or healthy adaptation to the stress or load, and there's also unhealthy adaptations to the stress or load. And Rad, you're sleeping on the camera there, mate.
It's all
And
me. Got to myself.
he's he's there in the background, but we don't really know if he is there in the background. What I was saying is there's both, I guess, a positive and a negative adaptation that can occur from exercise, and the negative adaptation is obviously when you walk away and there's some there's something wrong. You've hurt yourself, or you've triggered an old injury, or I guess you've mismanaged load. Would that be right?
Yeah, basically, like there's definitely the positive, and if you're recovering well, if you're doing it appropriately, like you will get stronger. That's the only way that the body adapts, is by getting a strain on the body. And yeah, if adapting goes well, but the same exercise that can be the thing that makes someone stronger can also completely injure someone if not done appropriately. So yeah, it's so context dependent, and that's where I think this discussion of it's not the exercise that injures you, it's the way you do it, because so many times you hear like people on the internet being like, oh, never do XYZ exercise, or you have a physio telling you like never deadlift because it's bad for your back, or things like that, where they really vilify the actual exercise itself and not looking at how that exercise can be in the context of all the different loading variables. So, someone with excellent programming doing really progressive overload of the different variables, which I think we'll jump into in a second, part of the what framework. So, looking at the actual exercise variables in the moment, that'll be very different if you progressively overload each of those compared to going into maybe a group fitness class where you've never done deadlift before in your life and you're gassed from having done a sprint on a bike, and then you get jump straight into a deadlift and then you just rip straight into it. So the context really matters. So definitely the same injuries that hurt you are also the same injuries that are going to make you stronger and better. And I have very personal experience with this because tendinopathies are one of my favorite injuries to manage, and they're all about load management. And it was one of the most common injuries when we were training at Unity Gym, because people got into calisthenics and lots of grip work, and haven't really, many people hadn't really done that much before. So, but it was like one of the only injuries I haven't actually had, because I've had most of them, but I hadn't had golfer's elbow up until then. But I kind of wanted to show people that it was exactly the same injuries that would hurt me would also be the same ones that rehab me. So I did as many pull-ups, as many chin-ups as I could as possible in a week, and as many wrist curls as I could in a week. And that sure enough gave me tendinopathy. But then at the same token, it was then the load management of dosing it correctly, giving adequate rest and recovery, that also meant that those same exercises end up being the thing that strengthened the tendon and made me feel better. So yeah, it's not the exercise that gets you, it's how you do it.
And that's such a great segue into where I want to take this discussion, because there are obviously ways that you could have continued to make that worse, and there's the positive outcome that you had, and those two paths were quite different, but you still did the same exercise. You didn't stop doing pull-ups, and so why don't we talk about what you did change, the variables that you did change, because this is where I think most people sort of get training a little bit wrong. There's, and I said this offline before we started recording, there seems to be this, like, there's no gray area in people's mindset around the depth of a movement or the load. You're either going max effort, or you're sort of not training, or you're going full depth, or you're doing partial range. But we actually teach people at Unity, and in the UMS app, very quickly, that range is a variable just like intensity. And when we say intensity, just for everyone playing at home, we're speaking about the weight that we're putting on a barbell, or the weight that we're holding in our hands with dumbbells or kettlebells or whatever that might be that you're using. That's the intensity variable. But we manipulate range of movement just the same as we manipulate intensity, and also volume, sets and reps, and time under tension with tempo. So why don't you go through how you did it with your pull-ups and your wrist exercises to overcome or rehab the elbow pain?
Yeah, for sure. So I think starting off with looking at, this is all in the what. So this is the programming side of things, as we talked about the load management before. And this is looking at within an exercise. It's the 5 variables to talk about is intensity. So that, as you said, weight in the bar or in the dumbbells, or mechanical disadvantage in calisthenic exercise, for example. Then it's going to be volume. So sets, reps, time under tension, rest between sets, all of those factors. Range of motion, so how deep the movement is, and or how far full range of motion, or are you just doing an isometric hold, so just in one position. Then it's going to be speed, so basically how intensely are you controlling the movement. So this I guess is more of that time under tension. Are you dive bombing, or are you slowly contracting and doing it with lots of control and bracing? And then the complexity or movement selection is the 5th one. So yeah, as you said, like, people do get so hung up on depth particularly. And I've kind of coined this as there's a bit of movement purism out there, where people are like, it doesn't count unless you're asked to grass, or it doesn't count unless you're this, that, and the other. And it just becomes so unhelpful, because it just means that people completely close off options for like both progression and particularly in the injury space of rehab, completely ruling out certain exercises like squats. Cause like, oh, if I'm not doing an arse grass squat, then it's a bad squat and it's, not not real. So yeah, being able to identify each of those 5 variables in the strength setting and be able to, this is where working with a physio if you do have an injury and identifying, okay, is it the intensity that is the most aggravating factor? Like, is it load dependent? How much extra weight I'm putting in the bar makes it more painful? Is it the volume? So am I fine for like 2 sets, but by the 5th set, it starts to get sore? Is it the range of motion? So can I squat to, parallel and it's fine with a heavy weight, or is it, is it painful to even do like a body weight squat down to, arse to grass? Then the speed. So if I really control the movement, brace and do slow eccentrics, pauses and coming back up, does that feel better than dive bombing and adding lots of speed or, elasticity to the movement? So that kind of rebounding impact. And then if, for example, with the chin ups now, with the chin up being the supinated grip, so your palms facing towards you, that's going to make it very much a bicep movement. When you're looking at a pull-up, it's going to be a combination of lats and biceps as being the sort of main prime movers. You've got to be re-dealt there for extension as well. But it's going to be more on the bicep side than a pronated, so your palms facing out. That's going to be less bicep in the movement. So it means that when we're looking at exercise selection, that can be a really nice variable where, particularly in this rehab example of golfer's elbow, going into a neutral grip or even a pronated pull-up is a nice way of being able to unload that area that I'd overloaded with the chin-ups and wrist curls. So to work through, I guess, those 5 variables in that chin-up context, when I tried to injure it, I tried to go for as high intensity as possible. So I didn't add extra weight onto the chin up. So I didn't wear a belt and add extra weight, but I went body weight and volume wise, I went to failure. So I went as many as I could. And then I was working at the gym so I could just come out and whenever I had a chance, I'd just try and do as many chin ups like to failure as possible. And then I didn't really give myself much rest because I did it each day of the week. So that's looking at the volume side of things, and range of motion, a bit less relevant in this particular instance for pull-ups, so not really too much of a factor. But then the speed does, like, again, less of a factor. I was trying to do eccentrics, but by the time you're at failure, you're just sort of jumping from the top. And then, exercise selection, I just did the same thing over and over again. So that's another thing. If you're doing lots of exercises that are similar muscle groups throughout the week, changing up the exercise selection to slightly change the ratio of the different muscles is a nice way of not injuring yourself. But I chose to do exactly the same thing over and over again, so I'd get exactly the same strain on the tendons. So that's how I hurt myself. Does that all make sense?
Yep.
Absolutely. And then coming back into rehab, I just looked to deload the intensity by doing feet assisted pull-ups. So I just, because with tendinopathy rehab, generally the idea is you're trying to get enough strain into the system that you're giving enough stimulus that your body realizes, like, hey, we better get these tendon fibers to start realigning in a productive way. Because the tendinopathy is basically your tendon overloads, it tries to heal and it starts to do a real patchwork, not very effective tendon. And so when it's past that kind of initial inflammatory stage, starting to get the load to the tendon again to encourage really good remodeling is the way to go. So you do need actually adequate intensity. And so I was using the feet assisted chin ups as a way of doing that, and unloading it slightly by going neutral grip if I could. And then doing less volume. So like getting enough stimulus to cause a bit of a stimulus, but then not doing it day after day, doing maybe 2 sessions a week with that. And then the range of motion being probably less because it was that feet assisted, so I didn't have to go quite as far. And often that sort of stretch load on the tendon as well, and that full end of range of motion in a passive hang, a bit more aggravating. And then exercise selection, as I said, going to that neutral grip, just unloading that particular part of the forearm a little bit more. So that's the pull-up example. And we could talk about the wrist curls, but hopefully that gives you an idea of, like, it's the same exercise, but just looking at changing a few of those variables. So I'm giving it the right dosage and giving it a chance to recover.
How long did it take you to recover? I remember this. I remember when you were doing it, I was laughing at you.
So it's definitely like, I went in a bit smug, like, oh, this is how you do it. And then it definitely
I remember it. I was like, what are you doing, man? I'm giving myself golfer's elbow. I want to learn it.
Because it's like, as a physio, you learn very, like, protocol based, like do this and this is how
Oh,
it
man.
heals, and you get
I
like
loved it. Mad
research
respect.
studies that are like, this is the average of what happens, but being the individual on the other side of that, like you can have so much variation between what research says versus the individual experience. And I think like the injury mindset is so challenging. So one of the things that it was hard, and particularly when I was trying to train quite hard at the time. But the biggest advice is like, if you've got an injury that's getting your upper body, like focus on your lower body for a while and make it not your entire focus. I think we're probably going to talk about this in another episode more so, but if you can, like what I had to do after a while was like just disconnect a little bit from upper body gains as being my primary focus, just to give it meaning that I didn't have to overload it again and again, because like a protocol is kind of easy of doing exercises, but then when you're trying to do training outside of that, or massaging as I was back then, like you start to get all these external loads in your day-to-day as well. So it's definitely tricky, but I mean, I don't have any issues with it now. I know a lot of people get really long-term stuff with the forearms. Like I think it was probably around the like 2 to 3 months until it was completely pain-free, but I was perfectly functional, able to do whatever I wanted to as well. So it wasn't a big factor.
Yeah, I still certainly have little issues with my tendinopathy, but I've had it 3 times, like noteworthy 3 times. The first time was awful because I didn't have a clue. I was very young. I had a young training age, meaning that I'd only actually been doing strength training for about 5 or 6 years. I was still in that sort of early body. Yeah, I know. Yeah. I was still in that early bodybuilding sort of goal phase where it was just try to get as big a pump as possible every single day. And I just ignored it until it got really, really bad. And I got now I know the world's worst advice. I went and saw a physio that was working in the gym at the time, and they said, you need to take 2 or 3 weeks off training and let it rest. And it actually got worse. I came back after 2 or 3 weeks, and the pain was far worse. It was instantaneous. The moment I picked up a warm-up set of dumbbells, it hurt. Whereas before, it would sort of hurt only once I got to a decent weight. Then, with this sort of injury, as the body warms up, the pain threshold increases, and you feel like, oh, maybe it's okay. But then after the workout, it feels awful. And so the first time round, I got the wrong advice, and the rehab process was really, really slow. Like it dragged out for about 8 to 12 months.
Often like kind of having 2 weeks off in a really like acute flare up first time, like really kind of classic kind of inflammatory overload, is not like the worst thing. Ideally, you do a little bit of light isometric work there, so holds and stuff like that. But when it starts to be that people think that I can't load it until it's pain free and rest for longer and longer and longer, that's where it starts to become really problematic, because it is that like you need that sort of therapeutic dose to again make it remodel effectively. And so what happens is people think, oh, I'm just not going to touch upper body, or not going to do anything that hurts it for 6, 8, 12 weeks, and then come back thinking I've rested, therefore I should be back to where I was before, and just get stuck in. And then your capacity over that time is really lowered, and suddenly you've then exceeded that threshold, and now you're back into pissing it off, and it becomes this downward spiral. It's really bad.
Yeah. So the second time around was in Unity, when we were friends and you were working there, and you basically said, I don't recall whether we did a specific session together or whether it was just during a workout, most likely just during a workout. And you said, does it hurt? Like, whereabouts does it hurt when you're doing the pull-up? And we sort of found the angle, and you said, all right, we'll just work in that angle. And so I did effectively partial range pull-ups for a while, and didn't overload it, didn't take it to failure. And I did the same thing with biceps, elbow curling and extending exercises. So biceps and triceps. And it probably only took a couple of weeks before it was pretty much gone. And the third time it happened was recently this year. And strangely enough, this year, the only thing I did was I stopped training for progress, as we spoke about in an earlier podcast. I just sort of flicked into upper body maintenance, and I introduced some supination to pronation exercises and some wrist flexion and extension exercises back into my routine as a supplementary, like an auxiliary at the end of my workout. and didn't change anything else. And it went away, it probably took about a month to
Yeah.
be completely symptom free. And then I went back to progressing my weights again and my loads again. But I didn't stop lifting at all. I didn't change any of my routine or program. I added a little bit of extra work in. And I always just sort of analyze other variables like, am I sleeping enough? Am I consuming enough dietary protein? What's my diet looking like? I had a very interesting experience lately where in the last couple of months, and this is completely off topic, but still injury, I started to get joint pain, like everywhere. It first started in my wrists and my hands, and I started to think, oh my God, I think I'm getting like some sort of arthritis or something because I'm boxing again, And initially I thought, okay, this is just initial adaptation. I need to back the boxing off a little bit. And I sort of just toned it down a little bit. But then I started to feel it in my ankles and my knees. And I was like, wow, this is like inflammation, systemic inflammation or something. And so, what you do when you've got AI as an assistant now, I jumped onto Chat GPT and started putting in all of my symptoms, and it sort of came back. So it always gives you I'm not a doctor, but it could be a number of things, and listed off a bunch of things. And then, one of the suggestions was to supplement curcumin. And I started supplementing curcumin about 5 days ago, and the experience has almost completely gone, which I found really, really interesting. I was like, oh, wow, that stuff, this sort of works, like.
Yeah, well, as a registered health professional, I'd have to recommend against using AI as your primary source. But I'm glad that you got good results, just as a
That's right.
professional responsibility to put that out there. But yeah, I mean, but that's a really good thing to point out. Is yeah. So good to use AI, but definitely work with a health professional.
Yeah,
So
yeah. Look,
yeah,
I would not recommend anyone do that, but you have to understand from my perspective, I am somewhat of a healthcare professional. I've been in the industry for a long time, and I have the mental fortitude to be able to spot something that would be entirely wrong. But it just helps me remember things that I've learned in the past and go, oh, hang on, because supplementing curcumin and things like that for inflammation and cutting back on highly processed, carbohydrates, sugars, fats, and things like that is stuff that I've learned a lot before. But I just looked at it and went, oh, okay, yeah, I'm going to try those things. But anyway, look, to bring this back onto topic, and maybe just quickly finishing up with a summary of the key point here, which is that loading is something that every single person must take into consideration, irrespective of whether you've got huge, audacious goals in fitness or whether you're just trying to manage some sort of discomfort, pain, or injury that you've had in the past, because you get a stimulus of load sitting in a chair. And if you just sit in a chair for a long period of time, it will most likely overload certain areas of your body. If you don't get up and move around and change the ratio of muscles that are firing, it can happen doing almost anything. And so, you really should understand. It's worth understanding this sort of thing, and then particularly if you're in the gym, where it's most applicable is to not be so black or white with your training, and remember that it's never the exercise that hurts you. It's never. I see so many comments saying hammer curls gave me elbow tendonitis, or deadlifting gave me back pain, or it's not the exercise that hurts you. It's the mismanagement of load, the piss poor load management, I used to say, that hurt you. And you've got to consider all of the different loading variables. Phil, just so that I don't take the limelight, why don't you finish by just quickly summarizing the loading variables that you like to work on with your patients,
yeah. So just
clients?
quickly, like I'd just like to think about a ladder, and basically with any injury, like you never want to get off the ladder entirely. You just want to go down enough rungs to be able to keep the adequate stimulus so that you don't go completely backwards and lose conditioning. So that might mean even if you're in like a cast and you're completely injured and you can't walk, you can do contralateral training where you get the neural stimulus. Like there's always something you can do to basically be maintaining some level of conditioning there. And then working with a professional, or really if you're very dialed in and you know this sort of stuff, is figuring out those different variables. So the intensity, volume, range of motion, speed of movement or control, and then exercise complexity or exercise variations, and knowing which levers you can pull there to basically go down the fewest amount of ladder rungs as you need to make sure that when you come back to work on that area again, once it's healed, or once you want to focus on there again, that you can make really good progress and not go backwards.
Awesome. Well, there you have it. Now, before we wrap up, if you're watching on YouTube, please make sure that you've gently caressed the like button, and what that does is help us help you. It helps us get this content out in front of more people and grow as a channel. And if you haven't already, subscribe to the channel and hit the little notification bell so you know when we go and post something new. If you're listening on the podcast, it really does go a long way if you give us a review. 5 stars never goes astray. And if you'd like to connect with Phil, where's the best place that they can find you, Phil?
My website is quite simple. It's my name, Phil White, and then .me. So nice and simple to jump on there. And if you want to follow any of my work, I'm posting every day on Twitter, writing an article every day about all this kind of stuff. So always open to questions and happy to help with whatever questions you have and go to depth to answer them.
Amazing. All right, guys, until next time, it's adios from me and Phil and Rad in the background there, doing the camera mixes and angles and coughing every once in a while.
No, they can't hear me coughing because I'm muted.
You're muted, mate.
See you soon, everybody.
We can't hear you.
Oh, you can't hear me. They can.
Oh, okay.
All right. See you soon, everybody.
See ya.